Nobody told me this in everyday life, but your gums can actually act like a warning light for your heart risk. Not because your dentist is a cardiologist, but inflammation and bacteria don't respect boundaries.
Welcome to Beyond the Smile. I'm Dr. Mahib Jaouni, founder of Endodontic Specialists and BioRejuvenate Med Spa, a board-certified endodontist practicing in Dallas for over 14 years. Over that time, I've performed more than 10,000 root canal treatments. My mission in this podcast is simple: to break down oral health topics with clarity and real clinical insight so you can understand your health beyond the smile.
I've looked at thousands of mouths, and there is a pattern. The people with chronic bleeding gums often have the same story. They have high blood pressure, diabetes, cholesterol meds, fatigue, and they'll say, "Doc, I feel fine. There's nothing wrong with me." But here's the simple version. Gum disease is chronic inflammation and a high bacterial load. When gums bleed, bacteria and inflammatory signals can enter the bloodstream, especially with chewing and brushing. So your immune system stays switched on. Over time, that inflammatory burden is associated with plaque buildup and cardiovascular events. So that's not good. You're getting ill, you're getting prone to heart disease and stroke. This isn't a fringe idea. The American Heart Association updated a scientific statement reinforcing the association between periodontal disease and atherosclerotic cardiovascular disease, while also being clear about what's association versus proven causation. We've got to be clear about that because that's an association. So we can't prove that it is causing it, but it's definitely associated with it, and there is a higher risk for that. So what makes my antenna go up is gums that bleed easily, deep pockets that have bone loss, heavy tartar and inflammation, and I look at a patient and see all that, or patients who haven't had constant cleanings. That combination is a red flag for systemic inflammation. You're putting yourself at risk to get a systemic disease, metabolic syndrome. So I'm not diagnosing heart disease in the dental chair. I'm just saying the mouth can be an early signal that you as a person need real medical check-in. So let's do this. If your gums bleed, don't just change the toothpaste. Get the gums treated and get your medical basics checked. Blood pressure, A1C, lipids, because inflammation clusters. Nobody told me the mouth can whisper about the heart. Now you know. If you like this video, press like and subscribe and check this video out.